Mr. Robert. My name is Kim. I'm a nursing student, and I'm going to close the door for privacy. I'm going to wash my hand with water and soap for 20 seconds. Okay, I'm going to check for the environment to make sure the environment there's no tripping hazard, there's no spill on the floor, and okay, okay, Mr. Robert, can you verify your date of birth and your ID?
6/22/78.
Okay, thank you. Okay, I'm going to see, and then could you tell me what the reason that you come to the clinic today?
Checkup.
Check-up? Did you mean the check-up or annual check-up or?
Yes, annual
Okay,
checkup.
annual check-up. I can ask you some question about some the day. Can you tell me something about your daily activity, your ritual?
I go to work and I go home.
Okay, and do you have any physical exercise?
Yes, exercise on the weekends.
The weekend to be 2 days a week, right?
Yes.
Mhm. And then could be the exercise, and how long is the exercise?
3 hours.
Exercise, what kind of exercise you do?
Walk.
Exercise or about okay, so I would like to ask you about some medical history. Do you have any health condition right now?
No.
Do you have any allergy, like allergy to the food, to the environment?
No, I don't have any food or medicine allergies.
Okay, have you ever been in hospitalization?
No.
Okay, so how about the surgery? Did you have any surgery like wisdom teeth surgery or
No.
any kind? So right now, do you take any medication like over the counter medication, prescription medication, or like?
No.
Medication about no about immunization. Do you have any immunization?
Yes, all my immunizations.
So you mean all the immunization up to date or something?
Yes.
How about flu shot? Did you take? When did you take the flu shot?
No flu shot. No flu shot.
So did you take a COVID vaccine?
Yes.
Okay, and how many doses?
2.
Can you, I can ask you the question that I ask everyone. So I wonder, have you ever drink alcohol?
Many years ago.
So for a long time you have not drank any alcohol. How about cigarette? Have you smoked a cigarette?
Quit smoking cigarettes a year ago.
And about so when did you smoke cigarette, and how many cigarettes did you smoke each day?
10.
So 10 to cigarette, and how long did you smoke?
10 years.
So you smoked cigarette for 10 years, and then you quit years ago.
Yes.
And how about the safety? Do you feel safety when you drive the car?
Yes.
And safety, do you feel you are safe at home?
Yes.
Okay, and then about at work, did you feel safety at work too?
Yes.
Okay. At home. Hi, are you tired today?
Yes.
So do you have any pain right now? And,
No.
okay. So my observation today is the patient is have clean hygiene and dress appropriate with the environment and patient is stay alert, orient time 4 and the patient speak clear and then complete sentence. This is for the main general. So he sit upright and feels comfortable when he talk. Okay, I finished with the general survey, so I'm going to move on to the vital sign. Okay, connect the feel the temperature. So okay, the temperature, I do not feel any cold, any fevers, and no fever. So so temperature within the normal range temperature, and then with the pain, you already the pain rate over 10, and now I'm going to start with step 1. Blood measure, blood pressure. Going to pump until I feel until the pulses go away. At 140, I do not see the pulse. So next time when I pump, I will pump to 160 and then I go from there. Okay, so can you put your both hand here over here so I can count your start counting your heart rate. So your heart rate is 78 and your breathing is 16. Okay, I finished with the exercise of the okay, and we'll continue with the the blood pressure. Continue with the blood pressure. This is the sexual blood pressure. on the one sitting. Rồi, jangan bakar ikan itu. I finish with the vital sign. So I'm going to move on with the interviewmentary system. So I will start with the head and we check with the hair. I feel that the hair is soft, silky, and then distribute evenly. So there's no sign of hair loss or hair thinning. All right, I'm going to look at the head on the scalp. Scalp doesn't have any lesion, no sign of hair loss, flapping, and the hair. So I can feel this the skin. I can see the skin at the face, the arm, and the neck, and the back. So the skin temperature, the upper temperature and lower temperature, the skin temperature is even and within the normal range temperature, and the skin is smooth, consistent, and appropriate with the ethnicity. And do not see any deformity, both upper or lower extremity, and I do not see any deformity, any nodule, any masses on the both the upper lower extremity, and then the face and the face and the neck and back. And then the rest and the face is with address with the expression and with the movement. Okay, that's for the interviewmentary system. So I'm going to move on to the head knot. I can start with the head. The head is the skull is round and soft and smooth, and then okay, and I do not see any lesions, any masses in the head, and then is symmetry the head, and then the face address, and then with the expression and the movement that the head, and then the ear. I can see the ear both sides. Both sides, there is no discharge, no discharge, no redness, no sparkling, no noodle, anything. So, and look, the side is appropriate side, and then the symmetry on both sides of the ear. And then look at the eyebrow is full and thickness and smooth, and symmetric eyebrow. So I can feel the eyes. Eye orbital. I do not see any. There's no sign of sucking, no sign of noodle, and no sign of edema for the orbital, and that's for the eyelids. I do not see the eyelids. No, do not see any redness, no swollen, swelling, and I do not see any sign, no sign of sty or acropion, and the eye. So I'm going to continue leave, so I can leave the conjunctiva. Let's see how. So conjunctiva, I can see that there's no sign of conjunctivitis, So conjunctiva is moist and sharp, it's moist. Then I can easily open and close it easily. And then I use the pen line to see it for both sides. I do not see any sign of lesion on the cornea of the eyes. That's for the eye and for the nose. I can feel the nose for deviation, so I do not see any deviation and no tenderness on the nose and no displacement of the cartilage. And then I can look at the inside in the neck. I can see the no sign of narrowing, no sign of flowering, and no sign of discharge at the narrowing nails. That's the nose and the mouth and lip is appropriate, soft, appropriate with the ethnicity. And then I can look and you open the mouth, I can see. So I can see the gum is the gum, and then mucosa is pink and moist, and doesn't have any bleeding and the redness. And then I can see the teeth. I can see the teeth. I do not see a cavity. I do not see a missing teeth. And then for the tongue is no coating, no lesion. Let's see again. No other coating. Because okay. So overlap midline and oropharynx is the pink moist and there's no sign of exudate or no sign of redness and the tonsil is one plus and no sign of exudate or redness. So I use those. Okay, so I don't look for the lymph node. It's gonna be a lymph node. I'm going to start with the occipital here, and then this is a pre-auricle, and then posterior auricle here, and then this is the submental would be the tonsillar, submandibular, submandible. And then this is anterior auricle, and let's see, anterior cervical and posterior cervical, and then supraclavicular lymph node. So I do not see any sign of a lymph node on the neck. So we finish with the renal system and lymphatic system. So I continue to move on to the cardiovascular systems. Let me start with listen to your heart sound. But I could start at the intercostal, the second intercostal. To be extra loud here. And then go to the side. Could be pulmonary. And could be absent. All right, and then I move on to the tricuspid sound. All right, and then move on to the minstrel valve. There could be S1 sound to be louded. I'm thinking that normal, so the patient heart sound is a normal heart sound pattern, and I do not see any lip or hip or then any mobile heart sound. So for the, you can see the hand, where I see both the upper extremities. I do not see any edema, and then could be capillary refill within 2 seconds. So can you move over here for me so I can check the lower extremity just so you can see. Put your foot on it. Right. So I can see check for the pulse rate and the pulse here. B. The fail is the pulse here. All right, and then the pulse rate is also equal both sides, bilateral, and 75 pulse per minute, and then the lower extremity capillary fail also within 2 seconds. Okay, so I finished with the cardiovascular system. Then move on to the respiratory. Can you see after that? So I can with the respiratory system. So from my observation is the patient with a breathing is normal breathing, even pattern, no easy breathing is easy, no even level like unlabeled breathing. So I can put my both my hand over here, so I can you breathe deeply with your mouth for me. I can see that the thorax expansion is full and systematically. Okay, so I will start with could be I will listen to the lung sound in the front, the back, and the sides. So I can start the back first. Breathe deeply for me. Yeah, breathe deeply for me. So I'm going to listen to both sides. The other side. Yeah, breathe deeply. Breathe deeply. Huh. Right, start with the front. Start with the front. So I see that the normal breathing pattern, and then escalated normal but breathing pattern for the oscillation. So I do not feel any abnormal, any adventitious lung sound. Okay, I'm thinking about you may lie down. I try to listen to your abdominal. It's okay when you up your station. So I'm very looking at the abdominal. I realize that abdominal look round shape, and then the skin is smooth and symmetrical, and with the color is appropriate with consistency with the ethnicity, and then I do not see any pulsation. Okay, so I'm going to listen to the 4 quadrant sounds. So normal active or bowel sound. That's what I feel with oscillation. So I don't see anything abnormal with the bowel sound. So I'm going to ask palpate your I don't know. So you don't feel any? Do you feel any discomfort?
No.
I finish with the abdominal system. Okay, I think you can just sit out here so I can start with the neural system. Start with the cranial nerve. Cranial nerve could be start with the cranial nerve number 1 and number 2. Okay, we differ. So we start with the cranial nerve number 3. So okay, so I will start to look at the people to so the people both sides equal and round and reactive with the light and accommodation. So can you look at my finger and then look at the defibrillator for me? You can see. I can see that the people dilate when they see further, and then when contract when they see closer. So the people. So therefore the cranial nerve number 3 is active. So the cranial nerve number 4, number 6, and I can try to do this to be a second visual field. So you can look at, can you follow the pen light? The pen light. See for me. So the cranial nerve number 4 and 6 and E-type. Like cranial nerve number 5. Okay, now you can close your eye for me, and then and you tell me where is the top away.
Yeah.
Right.
Cheek.
Okay.
Cheek. Yeah.
Okay, and then can you bite down for me? Okay, all right. So cranial nerve number 5 is E-type. We can move on to cranial nerve number 7. Can you close your eye and you smile for me? And you pop your cheek. Okay, so eyes raise or eyebrow. Okay, yeah. So cranial nerve number 7, the E-type. So cranial nerve number 8, and you feel the finger wrap. Okay, so cranial nerve number 8 is inside. Cranial number 9 is can be swollen for me. Swallow, yeah. So the cranial nerve number 9 is inside. And now you open the mouth, say okay, so cranial nerve number 10 is inside. The cranial nerve number 11 can you place your shoulder. So the cranial nerve number 11, so can you turn the light head again resistance. So cranial nerve number 11 is inside. Cranial nerve number 12, and you protrude the tongue and then put them left and right and up and down. So cranial nerve number 12 is inside. Okay, now you can also do the movement. So you close the eye, and then you do alternative the pattern the finger, Okay, so that's good. Okay, that can be with the finger with the finger thumb with finger. So accuracy that is that. Okay, that's good. So now you can walk across the room from me so I can feel the signal well. So the patient can walk across the room, so the steady guy without edit, and then with the swing opposite arm swing. Okay, that's good. So when you stand up, so we can start with the rumble side, the rumble side. So close your eyes and see. So rumble side could be negative rumble, some of the side that we are expecting, so that'd be good. So we finish with so just sit down, and then I can try to try the patella reflex. You can sit here for me to try it patella reflex. Maybe you cross the leg here so I can easy. I want to do okay, good. Patella reflex. Okay, so okay. Okay, all right, that will be over reflex, also the patella reflex. Okay, so we finish with the neural system, so I will move on to the muscular skeletal system. When you sit there, stand up with me, so we can do some physical exercise. Be so with the start with the shoulder, we can try the shoulder flexion, extensions, right, lateral flexion, left and right, and then rotation, the head rotation. Okay. That's the speaker. So now with the shoulder, we can be flexions, all right, extension, upward extension. Okay, that's good. And then abduction, adduction. Adduction. Okay, so on the elbow, so we with the flexion, extension. All right. So and then the wrist will be supination, pronation. All right. So it can be flexion, extension, hyper extensions. All right, and then for the finger will be flexion, extensions, abduction, and adduction. That's it for our upper extremity. Okay, so we go to the lower extremity. Would be the hip, would be flexion, extension, flexion, extension. All right, the adduction, adduction, abduction, adduction. Okay, so it'll be rotation. So yeah, outward rotation, inward rotation. Okay, so flexion, inward rotation, outward rotation, flexion, extension, Awesome, okay. Okay, so with maybe you sit down and then you can try to sit down over here so you can see in the video. So will be inward sense outward rotation, inward rotation. I'm thinking of start with the arms with the strength that now can you hold a big strength and hold it so tight for me. Okay, good strength 5 So I'm going to start try with the bicep and tricep. So it will be again my resistance would be okay. Put tricep, bicep and tricep. That's good. 5/5 bicep, tricep, and then this will be again really good. Okay, hamstring quadrant and again okay, hamstring quadrant. That's good. Okay, that's to lift up the see it. Go over here. You can see your feet. So we lift up your feet. So again, my resistance. Oh, again, already. Oh, good. Okay, and then. Okay, that's good. So, but then reflect those are reflect extend over 5/5 again the resistance. All right. So I think I'm going to ask you to standing up so you can look at the contour and the bike, and then you can see that there's no sign. I have not seen any sign of lordosis, lumbar, and then the area. So no sign of lordosis, no sign of kyphosis, and no sign of cirrhosis. All right, so I think I finished with the health assessment. Do you have any questions for me?
Yep.
Okay, well, thank you. So I'm going to talk with my professor.